and welcome. You're watching Living with COVID. We're joined by a panel of doctors who will help us navigate with the new normal as India enters several phases of the unlock. What are the do's and don'ts that one needs to follow as we get on with our daily lives? We have today with us Dr. Akash Kumar Singh. He's a director at the Spandan Medi-Speciality Hospital, joining us from Vadodara. He specializes in internal medicine and diabetes. We also have Dr. B'K.Sundar, who's a consultant physician, internal medicine and cardiology from the BKF Hospital in Florida. Appreciate both you doctors for joining us and taking out your time. Many patients at this time are apprehensive of visiting hospitals and clinics for physical tests or checkups. They're afraid that they may contract the infection if they go to a doctor. So Dr. Singh, can you explain some of the protocols that you're following, segregating patients, and making sure that patients who come to visit you for routine checkups do not contract the infection?
First of all, I must tell you that I have two hospitals here. One hospital caters to COVID patients, and the hospital which I do my OPD is a non-COVID hospital. Second thing I must tell you is that I have not closed down my hospital even for a single day during the lockdown, because being a person who is supposed to manage COVID patients, I felt it was my duty that I should make day-to-day observation, make day-to-day improvement in my clinic, in the safety measures, update myself, and implement all the safety measures that are required to prevent my staff and my patients from getting the infection. And we have been doing this continuously from March end, when the lockdown has been implemented. In the morning, before I come to my consulting, everything is basically sprayed with 1% sodium hypochlorite solution. And the appointments, the receptionist will ask whether the patient has fever, cough, cold, any respiratory complaints. And if such patients are there, then they are called to the different hospitals.
All right. Well, that's quite an achievement, Doctor, to boast about, and very important that you are, in fact, segregating your patients in a manner that you are. Dr. Sundar, would you like to explain any protocols that you're following, especially in examination rooms? I think that's one of the big fears with several patients being examined in the same space. So what are the kinds of protocols that you're following?
The patients coming to the hospital are also quite wary of coming to the hospital because they think that they might contract the disease. First of all, we must definitely reassure them that we are taking all the necessary precautions to make sure that they are safe. That's very important. And once they come in, it's quite intimidating for them to see doctors in a different setup. It's a new normal for us. We are wearing all the face masks, the respiratory masks, the visors, the gloves, which we are not used to basically. And the doctors are also not used to, and the patients are also not used to seeing the doctors like that. So it can be quite intimidating as well. So basically, when they come into the clinic, we make sure, into the office room, we make sure that they come alone without any attendants. And even then they're coming alone, because of the spacing, we make sure that they're sitting apart. They're sitting at least 6 feet apart. And basically, we need to tell them that we'll examining them only if it is absolutely essential. And this is a new normal again, because going close to the patients also can basically two-way. I mean, it is a risk not only to the doctors, but also to the patients. And if there is something to be examined and they're on the couch, and obviously the couch will be, after we examine the patient, we normally sanitize the couch once the patient leaves the office room. And in some places where there is a constraint of space, then they might have a plastic curtain between the patient and the doctor, so that you interrogate the patient and talk to them and make sure that they also feel comfortable and safe. The most important thing would be, again, for the room where you are examining the patient should have adequate ventilation, so that the windows are kept open and you don't switch on the AC for whatever it's worth, and make sure that there's a fan which will circulate the air to drive away outside, the inside air to the outside. So many things that we need to make sure and ensure the safety of both the patient as well as the doctor. And this is a new normal for us. Now, doctors are not used to seeing patients just interrogating them and then letting them away. We are used to the age-old school of the history taking, the percussion, auscultation, and palpation. So these are the sort of things that we normally do, but we are now doing a different approach to the patient. So these are some of the things that we normally take. And absolutely essential is the patient should wear a mask when they come into the hospital, when they come to see us. So without a mask, they are not allowed to enter to the hospital at all. And they all sanitize their hands, and we sanitize their hands and touch them or examine them if at all we need to examine them. So either way, the basic principle of sanitizing, the masking, as well as social distancing is absolutely taken care of.
All right, so that's very interesting. As the number of COVID positive cases, there also seems to be a shortage of space in hospitals in such a scenario. Dr. Singh, what's your advice on home-based COVID care?
Actually, I am a member of COVID committee for control of COVID in BALLARI, and yesterday only we had a meeting with Chief Minister Mr. Rupani. And my suggestion was that we should now go ahead with a massive program of home-based COVID care.
All right. Now, Dr. Sundar, it has been seen that many COVID patients die because of heart attacks. Are people with existing heart disease at a higher risk of complications as a result of COVID?
Yes, I mean, we have seen quite a number of patients with comorbidities getting the COVID-19 infections. I mean, we don't have a data as yet as to tell us how many percent of patients with comorbidities develop the COVID-19. But I mean, I suspect they have, I mean, we are equal to get the COVID-19 infections. Having said that, people with comorbidities, they have a poor prognosis when compared to people who don't have comorbidities, and especially in elderly population. So this is the data coming out from China, where they found out that they've studied about 1,600 patients with comorbidities, and they found that the cardiovascular disease was the third most common comorbidity in these patients. So coming to that, I mean, this COVID-19 is a sort of an inflammation which is happening on the vessel walls, and we all know that, I mean, over a period of time, we have found out that it is more of inflammation of the vessel walls, especially the lungs and the heart and those kind of things, which can cause the rupture of the plaque, which is already present, and that can present as an acute coronary syndrome. And they can also affect the myocardium, that is the heart muscle, and that can cause myocarditis, and that what we call as myocarditis, and that can cause what we call as a heart failure. So we see so many other cardiovascular diseases. We see arrhythmias, that is a disturbance in the heartbeats, and then we see heart failures, and unfortunately, people who are non-survivors have more died due to a heart failure. About 50% of them have heart failure compared to survivors who had only 12% of survivors had heart failure. So that's one of the biggest marker of death in patients who have got heart disease. So basically, the heart failures and the myocarditis and acute coronary syndromes are more predisposed in patients who got COVID-19, and we have seen more and more patients with COVID-19 patients present as heart attacks. So that's a new presentation. Most important thing to remember is that more and more patients, it's better that they recognize the symptoms of COVID-19 early and present early so that they can be treated and prevent certain complications, especially in the elderly population, people who have got comorbidities. Because what they have found out is that the case fatality rates for patients with comorbidities are high. I mean, it's about 10% when compared to people who have got no comorbidities, about 2%. So to prevent that, so basically we have to make sure that we recognize these symptoms early and start treatment early, and to make sure that we don't push them into complications of heart failure and myocarditis and arrhythmias and death.
All right. Well, thanks so much for that. Now, we're going to slip into a very small break at this moment, but coming up on the other side, we're going to talk about how to differentiate the symptoms of COVID from the symptoms of a common flu. Welcome back. Well, now I'd like to go to you, Dr. Singh, to ask you, how do you differentiate between the symptoms of COVID from the symptoms of the common flu? All right, that's very interesting. Now, Dr. Sundar, if I can come back to you, speaking about heart patients, what time or what can be managed at home, and what are the symptoms that are typical telltale signs that they must be hospitalized?
Obviously, patients who are having heart disease, who have had a heart attack in the past and who have had some stents done, or who are hypertensives, they have to continue taking their medications as usual. Most important thing is they should have the supplies of medicines for at least 30 days. Make sure that they don't skip. Make sure that they have a healthy, balanced diet, and have some reasonable physical activity within the home, because you're not allowed to go out, and make sure that you are staying indoors. Having said that, doesn't necessarily mean that they should default on their medicines. They have to take medicines regularly. As and when it gets over, they have to replace it and replenish it. Most of them, if they have a chest pain, obviously they have to come to the hospital. They should not neglect signs of, say, chest pain or breathing difficulty, wherein they have to have medical help ASAP. They should not neglect these signs. Few of them will have some twinges here and there, niggles here and there, which are not like their usual cardiac niggles, in which case they can consult a doctor, either do a teleconsult or a phone consult, and then make sure that they are not missing out on anything. Sometimes it can be very tricky. It can be very tricky in the sense that it's very difficult to differentiate between a cardiac pain and a muscular pain most of the times. And the patients, sometimes they confuse it with what we call as gas, and then they start taking in the gas pills, that is the pantoprazols or ranitidines and things like that, and they end up coming to the hospital late. So let them not get carried away. Let them make sure that they're not missing anything. They can call up their routine doctor to find out what's happening. And in case they have a problem, they should not hesitate to go to the hospital. And this is a pandemic which has given us a very a different situation altogether. We are asking people not to come to the hospital, wherein earlier we used to tell them to come to the hospital, but now we're desisting them from coming to the hospital. But in situations, we have to make sure that they come to the hospital, get an ECG, and make sure that it's not cardiac and they're not missing out on anything major.
Okay, now speaking of hospital care, Dr. Singh, can you explain what the treatment costs or modalities are when a patient suffering from COVID is admitted to the ICU for treatment? And there's a lot of curiosity around the role of remdesivir in the treatment of COVID. All right, well, I think that's a really important perspective. Thank you so much, doctors, for joining us. Thank you all for watching at home. Goodbye.
Knowledge Partner.